What is up, Sleep Tribe? Welcome to a brand new episode of the Healthy Sleep Revolution podcast. My name is Dr. Meghna Dasani. I am so stoked to talk to our guest today. I have been stalking her on social media. I'm a huge fan of her. I say I want to be her when I grow up. But today I want to introduce you guys to Dr. Shereen Lim, all the way from Australia. She has the coolest accent, by the way. I am just fangirling over her today. So welcome to the show. It is such a pleasure to have you. How are you?
Yeah, no, thanks very much. That's so kind of you to say, because I actually love what you do, the dedication you've done to speaking and putting out these books. So that's super.
Well, thank you. And you have a brand new book too, right? Tell us about that. Let's jump into it. Tell us about your new book. And thank you for my coffee, by the way. I was so excited to get it.
Awesome. Yeah, the book is called Breathe, Sleep and Thrive. And really, it's a book that's to help parents understand that the snoring and obstructive sleep apnea, they have their developmental origins in early childhood. And so what are the clues that they can look out for to ensure their child is breathing well during from infancy, as well as developing good airways as well. So just identifying what are the key building blocks to get good breathing and what they can do when things are off track.
Perfect. And I'm assuming this book is on Amazon. Is that correct?
Yeah.
Perfect. So for our listeners, for one, go follow her Instagram page. Second, go buy that book. It's on Amazon. I have it. I highly, highly recommend. Every parent should have this book on their bookshelf. Every practitioner, and I know a lot of you docs listen in, so don't pretend you aren't. Go buy this book. You will not be sorry you did. So Shereen, you are a general dentist by training. Is that right?
Yeah, I did a qualification course in dental sleep medicine because I was really interested in how to solve my husband's snoring. And so that's really how come I'm involved with these sort of problems, because it is a craniofacial problem, which means it's a problem of poor jaw development. So how can we address that early on? And that's really how I've got into all the other things that I do in terms of developing people's jaws well during childhood and actually addressing the root causes of poor jaw development.
Yeah, what a similar story we share. I got into sleep medicine the exact same way, wanting to help, my adult patients, my family members. And then you're like, oh my gosh, this is so much bigger than just this. So as I understand, currently your practice is limited to treating just airway issues. Is that right?
Correct. So right now I'm really focused on tongue tie management from infancy through to adults, as well as doing the early interceptive orthodontics. And our team, we are involved in myofunctional therapy. So we do a lot of that, as well as the occasional dental sleep appliance for adults.
Okay, so if you are a child, adult, ages 0 to 100, she's your girl, for sure, for anything to do with sleep. What prompted the shift from general dentistry into transitioning purely into sleep?
I feel there is a very big void in this area. And the more that we look into it, there are so many people that are having unaddressed problems very early on in life. And I think it's really important that we help fill this void so that we can help children to their full potential, as well as prevent them from growing into adults with all these difficult problems. So, when I see the adults, I was pretty despaired. A lot of adults are really, they're seeing different specialists for their heart problems or their depression or their reflux medications. And it's very disjointed and no one's really looking at these poor breathing and poor sleep issues. And so I did want to get closer to the root of the cause. But even when we do jaw development in early childhood, there's a lot of children that have got very many missed opportunities as well. They've had, speech problems or difficulties with their breastfeeding or difficulties with chewing and swallowing. So there's so many different things. And a lot of them, they're not functioning really well. They've got ADHD type behaviors, poor attention, concentration, poor emotional regulation. So I just feel that it's really important that we help those people because we want to prevent them from getting those more despairing problems with adults, and that are much harder to solve at that time. So, we see a lot of people that fly in and fly out there. I think for many parts of the world, there's not a lot of operators to be able to do this. Mm-hmm. And so it is really important to be able to try to help as many people as possible. And I've got, other dentists and my husband here that can take care of the general dentistry. So I did want to become involved with it. It's a really rewarding part of the profession to be in.
That is so amazing. I love that you found a gap, you found a niche that needed somebody to fill it, and you fill that void while doing something you love. Love it. Love it. Absolutely love it. So let's get into everything sleep. As I mentioned when we were chatting before we started the recording, a lot of our listeners are parents. What should a mom be looking for? What should be her red flag? And let's start with infants. What are the things that moms need to be aware of, looking for, that could signal a possible sleep issue in their newborns? Let's start with their newborns, and then we'll move up as the kids get older.
Yeah. So if we recognize these breathing problems are related to poor jaw development, because poor jaw development means we have narrow nasal passages, reduced tongue space, and reduced support for our collapsible airways, we need to focus on having really good jaw development from infancy, because the jaws grow maximally between the 60% is complete before the age of 6 years. And so if you look at that first year of life, it is a really critical window, because this is when children are growing most rapidly. And if we understand that form follows function, it is those oral dysfunctions and how the way the muscles grow that actually stimulates how the jaws are going to develop. So in the first year of life, we really need to make sure that we have good breastfeeding where possible. So with breastfeeding, it requires good tongue suction to actually create the vacuum to extract the milk. And every time that tongue is raising to the palate to create that suction, it's also broadening the palate or shaping the palate. So breastfeeding is sometimes called nature's palate expander because when it's done well, it actually stimulates all the muscles in the way that they're supposed to work. And it develops those chewing muscles, develops the whole face forward, as well as expands that palate. And so we really want to make sure that if there's any breastfeeding issues, that we can address that. And so sometimes it means looking at tongue tie, because that can restrict normal elevation or suction of the tongue. And if there are problems with painful latching or poor drainage, mastitis, or the perception of low milk supply, it could all be related to tongue tie. So I think tongue tie is really important to look for, as well as making sure that we have optimal breastfeeding, not just good weight gain and not just having no pain and putting people onto bottles or putting onto shields. We want to make sure that the muscles are working really well. And then we want to avoid dummies or pacifiers, as you guys call them. So what they do is they actually lower the tongue posture. And so when a lot of people will say, my baby only uses it for sleep. But if we recognize that babies sleep for the majority of time, that is actually not allowing the tongue to rest properly in the roof of the mouth to develop that palate, and it's altering the sucking pattern as well, the sucking and swallowing. So we have distortion with the inward sucking pressures of the lips and cheek, and really promoting nasal breathing. I think they are really the keys during infancy: breastfeeding, nasal breathing, and avoiding dummies.
Yeah, for sure. And then especially for moms that are listening in, you don't have to stick it out. Breastfeeding does not have to be painful, does not have to be uncomfortable. I see so many of these moms that give up breastfeeding because they're like, it was just too much work. My baby took so long to eat, or it hurt too much, or it was just easier to give them the bottle. It should not be a chore. Ask for help. Make sure you're getting evaluated. And like Dr. Lim said, see if there's a tongue tie that's causing this, that's contributing to any of these issues. So ask questions always. Pain is not normal, correct? Would you agree with me on that?
That's correct. If we have pain, it's an indication that there may be a more shallow latch. And when the latch is shallow, a baby is not going to be able to use their tongue optimally. They will tend to be overusing their lips and cheeks. Right. And so the other key point to mention as well is we don't want to guilt parents into breastfeeding. There are certain parents that are not able to do it or who don't want to, but it is important that we promote those mechanical benefits of breastfeeding because there are a lot of parents that are really let down by the system, and they're the ones that are going to tend to feel more guilty. But also, if we understand that jaw development is, still going to be occurring those first few years of life, we have other opportunities down the track to actually restore more normal function if we can't do it as well.
And what would this look like in toddlers? What does a tongue tie look like or impact as the child gets older? What should parents be looking for?
Yeah, so when the tongue is restricted, a lot of people will think that if the tongue can poke forward, that there is no problem. But really, when it comes to tongue function in swallowing or palate development or for good breathing and good speech articulation, we need good elevation. So it's not simply enough to say that things are okay if the tongue can protrude. We really need to lift up the tongue or see how the tongue lifts and suctions to the roof of the mouth. So what are things that people can look for? Well, common clues could be dysfunctional swallowing. And so a lot of children, for instance, they may have problems with manipulating their food. They may use their fingers to move their food around, or they may have trouble swallowing and choking on foods. They really can't manage more chewy foods. They may pouch them rather than chew and swallow them, or even choke on them. And then as they get older, we may have more things like speech articulation issues with lisping. Lisping is a pretty good clue that the tongue is sitting low and not really well toned, and the root cause could be a tongue tie, as well as things like thumb sucking as well. I do think there's a strong correlation with tongue tie. We know that the tongue needs to rest in the roof of the mouth, and our mouth is richly, has a lot of sensory receptors, and particularly in the spot where we say N, there is a huge concentration of sensory receptors. And that's where the tongue tip is supposed to sit. And when the tongue sits in that spot, it's responsible for neurotransmission. We get signals to the brain, and then we release dopamine and serotonin, really good feel-good hormones. And when we can't do that, we may compensate. And I do think that thumb sucking is a compensation, because as children get older, we can actually get them very predictably to reduce thumb sucking if they're on board with the idea by getting their tongue back up in the spot. So those are the common issues. And then teeth grinding, because when we have low tongue tone or low tongue posture, it is more likely to collapse into the airway during sleep. And really, the teeth grinding can be a stress response to that restriction in airflow. So rather than having a complete obstruction of the airway, we will actually get a stress response or a fight or flight response to actually have an arousal from sleep and grind and reopen the airway. And so they are really common things that I see, in children, the chewing and speech problems, as well as the sleep disturbed breathing and teeth grinding being a really key red flag.
Yeah, and behavior issues too, like kids that aren't able to regulate their emotions, for lack of a better word. And then as these kids get a little older, the bedwetting becomes one of the signs to look out for as well. Would you agree with that? Is that something you see in a lot of the children you're treating?
Yeah, for sure. When I get a child in for a tongue tie consult, quite often they may come for a speech problem. But when that tongue is not working really well for speech, it's actually not going to work well during sleep to keep the airway open. So many of these children, the speech issues may go hand in hand with very disturbed sleep and poor concentration and attention, poor emotional regulation, and maybe behavioral concerns as well. So it is really interesting to think that sometimes parents are having a lot of struggles with their children and feeling like their child could be doing better. And it can come down to this string. And I know you're probably the same, where we identify that there is a tongue tie. How many parents get let down, or who will break down and cry and feel so let down? So these are really important things that we need more professional education on.
Yeah, and that was going to be my next question to you. A lot of times these get missed just because I guess they're not looking for it. And I tell parents this, not every provider is able to evaluate and assess things the way you and I are able to, because that's our specialty. We work head, face, and neck. That's our basic training. So your child sees the dentist every 6 months, make sure that, all of this is being evaluated. That being said, we need a team to be able to address these issues in our children that we're treating. Who or what makes up this team for you? Is it a myofunctional therapist? Do you provide myofunctional therapy in the office as well?
Yeah, we do have a team that helps with that. Mm-hmm.
And who else is part of that team? Do you have an IBCLC? Tell us more about that.
Yeah, with infancy, it is important. A tongue tie release is not a quick fix. It doesn't mean that a child is automatically going to feed properly after they have a tongue tie release. When you have a restricted tongue, even in utero, the sucking and swallowing is altered. So there are compensations that don't automatically correct. Much in the same way as if we have a cast on the arm that we're born with, we don't automatically move our arm really well once that cast is released. So it is important to work with people like IBCLCs, and there are different levels of expertise in tongue ties as well. So I prefer working with one that is really switched on as to looking at the how the mouth is working, rather than how can we position babies and how can we attach them. I want to look at someone that can work with babies' oral function and maybe give a few exercises to help promote better movement and function. And I work with a lot of
healing as well, right?
Pardon?
And that will impact healing as well for these kids.
That's correct, because if things don't move differently, we're prone to reattachment. and scarring. So it is really important to work with other people and not work in isolation. And I think another important person is the body worker. So I work with a lot of chiros and osteopaths, and I never do release without their assistance. And there's a huge number of reasons why. So we have a lot of those that we work with when babies are born, or when they're in utero, they have different positions. They're crammed into one position, and during the birth process, there's a lot of different things that happen to them, which can create restrictions or strains in different parts of their body. So we need these babies to be unwound or relaxed as much as possible before we get into the treatment, because the tongue is really connected to the rest of the body. And if we have through fascia, and if one area is tight, it actually restricts the tongue. So we need everything to be working really well. And we want to address any compressions between the neck and the base of the skull, because that's where a lot of sucking, swallowing, and breathing nerves are located as well. And it's just really good to have a really calm baby to work on as well, to really calm their nervous systems down. The less tight a baby is, I perceive that the healing will go well. They'll get better mobility of the tongue post-release. So we work with a lot of people like that.
Yeah, and we have a happier mama too, because the baby's able to latch on a lot easier. Feeding becomes so much easier for them as well. Yes.
I was going to say there are other problems with babies having restrictions, and that can affect their positioning as well.
Yeah, for
so
sure.
It's not just tongue tie.
Oh, yes, for sure. We have to remember, for those that are listening in, when providers like us that actually are working with the infant, and just because we're talking about babies right now, we're treating the child as a whole. We're not just isolating the tongue and say, oh, we're going to release the tongue and there you go, that's the end of it. No, there's pre and post-op follow-ups, body work, whoever other providers they're seeing, all of that needs to tighten. It literally does take a village to treat these kids. As far as our older kids, and even going all the way into adults, how important is myofunctional therapy? I know how important it is. I want to hear your words. How important is myofunctional therapy? What role does it play? And what does that look like in your practice?
Yeah, well, myofunctional therapy is about creating awareness of the poor muscle habits and actually introducing new patterns so that children can breathe well, their tongue can rest correctly and with a good tone and coordination, as well as good chewing, swallowing, speaking, and those type of things. And so, yes, it is really important, because when we have breathing issues, it's really a combination of structural problems as well as functional. How are the airway muscles working, including our throat and our tongue muscle? So specifically for tongue tie release, we're going to get the most functional release around the age of 5 years and up, where we can actually do myofunctional therapy and teach children where their tongue should sit, how to move their tongue without moving other muscles, and how to strengthen their tongue. Because the ultimate goal of a tongue tie release should be to get the tongue resting lightly suctioned to the roof of the mouth, and that's the best area for breathing. And so it typically takes it could take anywhere from 3 to 5 visits for a child to actually start to get their muscles well coordinated. And I usually want to get children to be able to suction their tongue even before the release, because that allows the most precise release. We can really see where is truly restricted and which part is actually just not toned yet. So that's what myofunctional therapy would look for a tongue tie release. And post-release, we would work more on the back of the tongue. But the other reason why it's really important is we need to restore nasal breathing for children that have had interventions to improve nasal surgery. So whether a child has had ENT surgery, removal of adenoids and tonsils, or whether they've had palate expansion to widen their nasal passages, a lot of these children, they haven't actually been breathing well through their nose before. They may have adopted compensations like an open mouth posture, and their jaw hangs slack and their tongue hangs low. So we need to retrain those new habits so that we can actually make sure that children are using their improved nasal passage or airway.
Yeah. That nasal breathing establishing is so important. Where does appliance expansion and appliance therapy come into play with all of this? Because there's so many moving parts. Do you usually wait for one to be done before you start with appliances, or how do you look at that?
Usually with the palate expanders, I usually like to do them first up. I find that they're the most predictable, efficient way to improve a child's breathing and also their tongue space so that we can do more effective therapy. And so I will start from as young as 3.5. I've done quite a few 3.5-year-olds. If they're not functioning or sleeping well, we'll look at doing that treatment earlier. And if we start with myofunctional therapy, it tends to be more compliance-based. And I think that if children don't have enough tongue space, or if their nasal passages aren't optimized, it may be more difficult for them to do the therapy, and less compliance, we may lose them before we've had a chance to really make a difference. Whereas I think palate expansion, within 6 weeks, most children will have a difference. Their parents will be able to report something different. So I really like to do the palate expansion first.
Yeah, I agree with you 100%. I work with my ENT closely, and there are times if a patient has found their way to him first, and he'll be like, nope, go get your expander done and I explained to parents that tongue needs room for us to be able to do the myofunctional therapy, for us to be able to release it. It needs its parking spot. If I don't have a parking spot, where is it going to go? So I agree with you 100%. Getting that expansion done does make a world of difference. And then you go into the myofunctional therapy, getting that tongue to sit where it needs to sit. And we just have a whole new child, is what I tell the mom. You're going to have a whole new child now because they're going to be breathing better. So much more opportunity that opens up for these kids. What is next for you after this book? What's coming up for you in the future? Are you speaking a lot? Are you traveling? What's coming up for you?
Yeah, there's always invitations, but right now my idea is to reach as many people as I can through the podcast. I would like to reach new audiences, getting direct to the parents. I've had such a fantastic result from colleagues and professionals, but it's really parents that are in need of this information, and it's the parents that are going to help drive more professionals to become more educated in these topics, and to be able to help spread more awareness of the need for greater integration, to be able to help more pediatricians or ENT specialists or different professions to understand we need to be working better together and addressing the root cause. So that's really where I want to go, to really disseminate this information really well. And I think always having that book just opens lots of new doors for us.
Yes, so awesome, because that's been my biggest goal too. It's like, how can I reach as many parents as I can? Because no one fights for their kid better than a mom that is educated and empowered. So, or a parent, I should say. So hats off to you for actually picking up this mantle and saying, this is what is needed. So we need more doctors like you. So thank you for that. How can people find you?
Well, the place that I'm most active, as you discovered yesterday, is not so much Instagram, but Facebook. I share a lot of cases and different information. Also, my website is drshereenlim.com.au, and also the book, to be able to read the book. And if you like it, to be able to share it with other people, because it has been of value to many different people to really help solve their child's problems with sleep and breathing.
That is perfect. Where is your practice located for our audiences that are in Australia, or anybody that chooses to fly to Australia to see you?
Yeah, so I'm located in Western Australia, in Perth.
And to our listeners, we will have all of her contact information, her Instagram handle, her Facebook, the website, her practice info, all of that in the show notes. So make sure you guys visit that. We'll have her bio. Go stalk her on Instagram. Go buy her book. She has tons of great information on there. So much education, so much awareness. And before we wrap up today's episode, what are your top 3 tips for parents that are listening today?
The top 3 tips. I think I'd really like parents to really understand the importance of nasal breathing. And so when your child has their adenoids and tonsils removed, it is really important that treatment doesn't end and start with the ENT surgery. We need to really address nasal breathing. And so sometimes that may include palate expansion, and sometimes that may include myofunctional therapy. And so in terms of the top 3 tips, I think really don't overlook palate expansion as an important intervention to help improve nasal breathing and to help with your child's sleep, and myofunctional therapy. Find out more about it for the stability of the results. Yes. That's 2, I think.
I think you kind of encompassed everything. Yes. So there is no standalone treatment modality. Just make sure you're not skipping one because you think you got something else, is what I always tell parents. Mm-hmm. And then lastly, and I know you will agree with me on this, I always tell parents, those that listen and know I'm constantly harping about this, don't be afraid to ask questions. Nobody knows your child like you do. So don't be afraid to push for answers. And if you know your child isn't sleeping well or needs more help, ask, reach out. Most of us are on social media. We're super active. We're always, and I know Dr. Lim is the same, always willing to guide you into whatever might be needed. We can't really diagnose or talk about treatment modalities on social media because we haven't been able to evaluate your child, but we can at least guide you into providers that may be around you that would be able to help. So don't be afraid to ask questions.
Absolutely. That third point being that don't lose sight of your intuition. Mother's intuition is nearly almost always right.
Oh my gosh. Yes, for sure. Well, thank you so much for your time today. It has been a pleasure having you and connecting with you. Now I actually have a voice and a face to the person I follow. So it's been my pleasure. Thank you for spending your time with us. And as always, go follow her on social media. Share this episode to anybody that you think would benefit from it and leave us a review. I will see everybody next time.